Hello friends. So coming to the topic that I'm always saying, these medicines do not cure the diseases. Okay. Uh, there is a concept called NNT, number needed to treat. The medicines, the tests, the surgeries, the supplements, advanced therapies, they actually don't work for everyone. They work only for some people and they just do not work. So today I have made a list, a scientifically prepared list, an accurate list of which test works for how many people, or which medicine is effective in how many people. Let's say if we take one medicine and it works for 1% out of 50, it is like this: how many people are needed to take a medicine so that it can be effective, so that at least one person will be benefited. If 100 people take the medicine and one person is benefited, the number NNT is 100 for that particular medicine. Okay, let's go on now. It's simple, try to understand. Once you understand this, you will lose faith, hope, that so much faith is there in medicine, so much faith is there in tests and diagnostics. Fine, it's life saving and all. In emergencies, it is the only option and works best. But even then, it does not work for all. Okay. Coming to common medicines, paracetamol, calpol, crocin, and all, they help only one person in 3 to 5. Only one among 3 to 5 people get the benefits, feel better. Ibuprofen or Brufen, it's painkiller. Okay, it helps 1 out of 3 to 4 people. Heart and blood clots diseases like aspirin, the medicines used here, aspirin is widely used for preventing heart attacks. Ecosprin, Ascard, these are the common brand names. The NNT number is 333. Only one person out of 333 people who are taking medicines, you know, the heart attack is preventable in one person only. Similarly, second heart attack prevention is like a person already had heart attack, recovered with surgery or treatment, and then they are giving ecosprin. It helps just one person out of 40. The NNT is 40. Cholesterol medicine, which prevents heart attack, atorvastatin, atorlip, Lipicure, the NNT is 38. Only 1 in 38% benefits. Rosuvastatin prevents stroke in just 1 out of 125 patients who have been given these medicines. Blood pressure medicines, Amlodipine, helps 1 in 100 avoid a major event. Telmisartan helps 1 in 40 to 50 patients. Losartan helps 1 in 40 to 50 patients. Ramipril helps 1 in 27 patients. Coming to diabetes medicines, Metformin, that is glycomate, Cetapin, prevents diabetes in pre-diabetes. If a pre-diabetic is taking these medicines for preventing development of full-blown diabetes, it helps just 1 out of 14 people. What about the 13? You just imagine. They just go into the diabetes. Only one gets benefit. Then dapagliflozin, that is Forxiga, Dapavel, helps heart failure in 1 out of 20 to 30 people. Then semaglutide, this is GLP-1 medicine, Rybelsus, Ozempic. Nowadays you may be hearing the word Ozempic very commonly. It's used for weight loss. It prevents major heart issues in 1 out of 50 to 70 individuals. Infections, you commonly know Agitrol, Jitrox, Azithromycin. It actually helps in throat infection in just 1 out of 4 to 6 individuals. It is widely used. So one person gets benefited. How the other 4 to 5 people are recovering? Naturally, their medicine is not really helping. Amoxicillin, it is augmentin, moxaclav, commonly used for inner ear infection, sinus and all. It helps just 1 out of 15 to 20 individuals. Coming to allergy and acidity medicines, cetirizine, it's very commonly taken nowadays. The NNT number is 5. Only 1% out of 5 people, feels relief. Pantoprazole helps 1 out of 3 people. Omeprazole helps 1 out of 3 to 4 people. Similarly, coming to asthma medicines, the inhalers, the sprays, pumps. There is budesonide inhaler, Budecort, Budamate. This prevents asthma attack in 1 out of 8 individuals. Salbutamol inhaler, that is Asthalin, Ventolin, it is very old one. It gives quick relief only in 1 out of 2 to 3 individuals. Mental health medicines, mainly the antidepressants. Sertraline, that is Zosert, Serlift, helps 1 in 7 individuals. Escitalopram, Nexito, Cipralax, helps 1 in 6 to 7 individuals. Olanzapine, that is Oliza, Olanix, helps 1 in 6 individuals. Bone medicines, commonly given for prevention of fracture, spinal cord fracture, that is alendronate. It helps just 1% out of 50 people in preventing spinal cord fractures. Then risodronate is commonly given for preventing hip fractures, and it just helps 1 out of 200 people in preventing hip fractures. And blood thinners, warfarin, it's one of the oldest drug. It prevents stroke in 1 out of 12 individuals. Apixaban, Eliquis, Apigat, prevents stroke in 1 out of 15 individuals. Heparin, it prevents heart attack in 1 out of 25 individuals. For quitting smoking, nicotine patches and gum patches, chewing or patches, they have come up nowadays, widely marketed and sold even by celebrities. Okay, but they help just 1 out of 20 people in quitting smoking. Nicotex, Nicogum, these things. Now coming to the big drugs for common fears, cancer medicines. There is chemotherapy, carboplatin, paclitaxel and all. They help some, they really save life, but harms many. Most of the people undergoing chemotherapy end up with severe side effects of it. There is immunotherapy. Keytruda helps 1 in 5 to 6 individuals. Targeted therapy of imitinib works only in people who have the exact gene mutation. It cannot help everyone. Hormone therapy, that is widely used for breast cancer, tamoxifen. It helps some, but it has extremely bad side effects. After the targeted hormone therapy for breast cancer, the lady ends up with severe side effects for many months and years. Then coming to oral chemotherapy, tablet and capsule form. Very little, just few percentage of people are benefited with this. But look at it, 100 people have to take for just few people to get the benefits. Autoimmune diseases. Coming to autoimmune diseases like rheumatoid arthritis, psoriasis, type 1 diabetes, all those things. Painful conditions, methotrexate, Folitrax, Imutrax, it helps just 1 out of 5 to 7 individuals. Adalimumab, it's a biologic injection. Humira, widely known as Humira, it is extremely expensive but helps just 1 out of 3 to 4 people. Steroids, prednisolone, omnacotil, they give instant relief, zero cure. Remember this. The steroids don't cure anything. Steroids are just for instant relief from the suffering. They don't cure anything at all, but they have heavy long term damage. They cause lifelong immunosuppression. Okay, so many side effects are there. Steroids. Hydroxychloroquine, it works only for some but pushed for many, commonly given. HCQS. Advanced heart and kidney drugs. Amiodarone, Cordorone, strong side effects but helps only few. Clopidogrel, Plavix, Clopivas, helps just one person when dozens of people are taking. Furosemide, Lasix, temporary relief but long-term dependence. This is given for clearing the accumulated retained water in the body, but the body starts getting dependent on this. Erythropoietin injections, they are given for kidney anemia condition. Vipox, Ericine, it helps someone but very expensive. Then there are hormonal disorders nowadays, very common. Thyroid medicine, levothyroxine, Theranor, Eltroxin. These actually help only when there is real hormonal deficiency. But what has happened is, even if there is little hormonal deficiency, now these drugs have been prescribed like anything. Millions of women are given these drugs, even for slighted deficiency. So what happens? If you are taking hormone from outside, our thyroid gland, feels negative. It has a negative feedback. It thinks it is working proper, and it becomes weaker and weaker. This is a huge issue. It's just given too easily everywhere, anywhere, especially for women. Then testosterone injections, they help few but very risky for many. Testosterone causes lots and lots of problems. PCOD hormone pills, you know, pills for inducing ovulation and all, many pills are given there. They control symptom, but the person never recovers from PCOD by those tablets. Ultimately, the recovery happens only through lifestyle correction. Then fertility hormones, follicle stimulating hormone, SCG, HMG and all. They help some but heavily marketed and prescribed. Then coming to neurological conditions, medicines used for brain and nerves. Levetiracetam, Levipil, it helps in epilepsy, prescribed for everything from headaches to stress. Losartan for severe schizophrenia, misused casually. Methylphenidate, it is marketed for ADHD. Concerta helps few but causes lifelong dependency because it is given at very early age. You can imagine how many side effects will happen later. Every medicine has thousands of side effects. Nerve pain medicine, pregabalin, Lyrica, pregabalin, very common. They help just 1 out of 8 people. Gabapentin, they just help 1 out of 8 people. Neurontin, gabapentin, this. Infertility medicines, letrozole, letoval, helps some during just some menstruation cycles, but it is overused. Clomiphene, that is clomid, can disturb hormones for many. It causes, because every hormone is very intricately interlinked with everything else in the body. IVF injections, success rate is just 20 to 30% per cycle, but the patient has to go through so many hormonal therapies, IVF cycles and all. You can imagine the suffering there. If a person goes for 5 IVF treatments, it may succeed one time. Then hospital antibiotics, meropenem, life-saving but massively overused. Linezolid, given even for mild infections. Vancomycin, it It is very strong but misused. Coming to surgeries, knee replacement surgery is now very commonly talked about. Knee pain from 1 year, go for knee replacement. But long-term relief happens in just 1 out of 6 individuals. Other 5 individuals end up with many more problems, troubles. Cataract surgery clears vision in 1 out of 4 people. It is one of the safest surgery, but even then it is not 100% perfect. Appendix removal has become like a very, 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 very common old surgery. From decades it is happening. But in reality, it is not needed for every appendix infection. Appendix is like a bedroom for the microorganisms. When the microbes in the gut are tired, they go to the appendix for resting. So earlier nobody studied about this and they thought appendix is useless, it is infected, remove it. That person will end up with low immunity lifelong. Gallbladder removal, the relief happens in just 1 out of 3 people. Angioplasty stent, it is life saving in emergency, there is no doubt about it. For stable heart patients, it just helps in 1 out of 50 people. C-section, cesarean section, it is needed for some in emergency, but it is heavily overused. You may be knowing that even in our district, and people have realized that if you go to hospital, they will push for C-section. Thyroid surgery often leads to lifelong hormone pills. Nowadays, the trend is to reject the thyroid, all those things. What about hormones later? The patient has to lifelong, use thyroid pills, but that is not it. The thyroid gland may be producing something else. It may have some roles we may never understand. So imagine the fate of that person. Hysterectomy, uterus removal. It gives actual relief in just 1 out of 3 people. And there are a lot of hormones and activities going on in uterus, so removal is not a good idea. Spine surgery, long-term success happens in just 1 out of 10 individual. That is 90% of the people with spine surgery end up with complications. Tonsil removal helps in just 1 person out of 8. Coming to tests and diagnosis, this is second category. We just had a look at medicines. Let's look at tests and diagnosis. Diagnostics. Vitamin D test. It's low, but what is the need for testing? Symptoms are there. Go and get sunlight. Thyroid tests. Even for small fluctuations reflected in thyroid tests, lifelong medicines are prescribed. This is how it is wrong. Full body checkups. Instead of making you feel healthy, the full body checkups gives you headaches, fears, heart attacks actually. Because when you check any body, anything, including me, you or anybody, some parameter will be definitely deviated. There is nothing called normal person. Nobody's all parameters will be normal at all the time. So what it does, it creates fear. MRI and CT scans for back pain show problems even in perfectly healthy people, because every backbone is different. Everyone's posture is different, everyone's working style is different, height, working style is different. So everyone has little bit variation, and after test it feels that someone is wrong. ECG, TMT stress test for low risk people, more false scares than benefit. Prostate specific antigen test for prostate cancer leads to unnecessary biopsies. Very small organ. Taking biopsy from there for the test. So damaging the organ. Right? Mammography in low risk women. See, mammary gland is a very hormonally controlled tissue, very active. So much milk is produced when the baby is there every day continuously for 2 years, 3 years. So there will definitely be lumps, tissues, growths happening. But by doing mammography, sometimes false positive results happen. Finds harmless lumps as fear and leading to procedures. Food sensitivity tests, the allergy tests, patch test. Everyone will be having some reaction to some foods. It's a natural thing. So whenever you take full body, full spectrum of allergy tests, it will show some as positive. Bone density scan, DEXA scan, one test, lifelong medicines. Supplements, multivitamins. There is no use of taking multivitamin tablets. The vitamins can be nicely, properly utilized by the body only when it comes from the food. Omega 3, very small benefit. Vitamin D tablets given too easily. Calcium leads to kidney stones. Iron causes constipation when unnecessary. How do you know the iron tablet is not necessary today? So if you are taking regularly, it leads to constipation. And constipation is the mother of all the diseases. B complex, temporarily it gives energy, feels good, but no use in the long term. Probiotics, they have short term benefits. Protein powders, mostly unnecessary, leading to protein overdose in the body. Vitamin C is just a marketing phenomena. It's not a magic. Collagen, cosmetic hope, weak results. Collagen injection and all those things happening. Now, common hospital practices that really don't help, but are heavily pushed and desired by the patients. ICU admission for mild cases, for typhoid, for dengue. You know, it's just a billing trick. More admissions, more billing. Daily blood tests. When a person is admitted in the hospital, daily blood tests are prescribed in some places. Just a billing trick. Okay. Unnecessary antibiotics. Just giving antibiotics immediately after hospital visit. Extra scans, saying we want to do more scans to confirm. Extra billing. Huge pre-surgery test packages. The surgery schedule, so many tests, blood test, urine test, fecal test, saliva test, so many tests are done nowadays. It's just a business trick. There is no need of this. Okay. High insulin use, quick control with some diabetics who have a spike in glucose, they are given a large quick dose of insulin, but it is not good. It saves life, but it has long-term consequences. Unnecessary biopsies. Uh, First one is tissue damage. Second one is spreading of the infection or disease or cancer cells happens through biopsies. Over monitoring, like glucose monitoring devices, continuous glucose monitors. It's continuous care. See, nothing in our body is constantly fixed. It's dynamic, it's living, it's always changing, right? Just our moods are always changing, our energy levels are always changing. Same thing is there inside also. So if you continuously monitor our body, there will be some highs and low, and it leads to scare. Similarly, health gadgets, fitness bands. The BP is high, heartbeat is high, this, that, and all. Some days you will be active, some days less active, some days more active, inactive, all those things. But the gadgets, this, what is that? Band, just like a smart watch or anything. It makes you constantly worried every day. So many things, so many parameters you are seeing. So what will happen? It gives you heart attacks. Glucometers for non-diabetics creates obsession. Non-diabetics are using glucometer nowadays to see whether they are getting diabetes. So it leads to obsessive behaviors. BP machines at home. The patient nowadays having BP machines to monitor their blood pressure. Any little variation will lead to more blood pressure because the person feels stressed. Sleep trackers. Less sleep, more worry. Gut microbiome kits, expensive guesswork. DNA tests. See, nowadays whole genome test, DNA test, mutation test, this, that, and all. Fine, you may find some mutation, but its relevance is really not known. Our body does not work on single gene, single mutation, single hormone. It's very intricate. There is no real truth in that. It is very small truth that our DNA, particular gene, has particular effect. After seeing all of this, I'm going to tell you the truth. When the body is dirty inside, clogged, inflamed, and overloaded, no medicine works fully. No surgery works fully. No test gives clarity. No supplements replaces nature. The real solution is simple. Clean the body by taking proper foods, using cleansing methods, go back to sunlight, activity, remove the toxins, lift the load, let the system reset. The real, take the medicine and surgery when necessary, that is for life-threatening conditions. But they cannot help you in long term. For hormonal issues, for reproductive issues and all, they are not life-threatening situations. So it's better to go for long-term approaches, that is lifestyle correction. The real long-term solution is cleansing, detox, sunlight, movement, simple natural food. And one of the most popular old method is castor oil cleansing. Done properly and consistently removes the internal garbage that medicines can never touch. Stop milk, sugar, maida, refined oils. Eat millets, fruits, vegetables. Eat local and seasonal. Sleep early. Walk in sunlight. Sweat daily. Live simple. When you clean the inner system, the body heals itself. Slowly, steadily, deeply from the root. This is reversal, not management. Actual freedom. See, 10 truths about industrial greed, the pharma industry. I'm not against doctors. Doctors are wonderful souls. Okay, they have studied so much. They have worked hard so much throughout their life. But they are also trapped in a system, of industrial. The hospital is an industry. The pharmaceutical is an industry. The diagnostics is a huge industry. So they are the ones, the real culprits. I'm going to tell 10 truths about industrial greed. They earn only when you stay unwell. They create daily users, not healthy people. Simple cures don't profit, so they stay hidden. Fear sells better than truth. Doctors are trained to manage disease, not reverse it. Every symptom becomes a new disease for a new pill. Research follows money. Hospitals earn from procedures, not from prevention. Guidelines follow industry pressure, not nature. The same companies sell the junk that causes disease and the medicines that treat it. Right? So this is the thing. So in future, before just suddenly going to hospital, test, diagnosis, medicine, surgery, wait, pause, go for natural methods, go for homeopathy, go for herbs, go for yoga, go for meditation. Try something which you have never done. Or if you have just been sitting, movement will definitely going to be instantly beneficial, right? So once you understand this concept of NNT, number needed to treat, for some of the medicines it is hundreds, in hundreds, 200, 300, like Ecosprin. Only one person out of 333 people is benefited by Ecosprin in preventing the first heart attack. What about 332 people who are given the medicine lifelong in most of the cases? So to benefit one people, 333 people have to take the medicine. So the hospital and pharma, they are benefiting 333 times by providing benefit to one person. Your chances of being in the 332 is much higher than being that one person. So that is what I am concerned about. Okay, take care. Bye bye.